Right, good evening, everybody. Lovely to see you all. And you are in for a real treat tonight. We have Esme Rode all the way from Gqeberha in South Africa. She is going to do the talk on Crohn's disease. She is a well-trained, highly qualified nursing sister, and she helped and taught many people over the years. So over to you, Esme. Um, Go for it.
Thank you, Barbara. Good evening, everybody. I'm going to be talking on Crohn's disease, and I chose this beautiful picture here. It reminds me of my crafting and artwork with all the lovely colors. And this is just something where it's a sketch of where all the enzymes and DNA and chromosomes and things are working together in a healthy body. I'm not going to go through all of that because it's Greek to me, some of it, but they all work together to ensure intestinal homeostasis. A disclaimer, any and all dietary supplements or nutritional products and treatment discussed here are not intended to diagnose, treat, prevent, or cure any health condition. The information is for general and educational purposes. So do not remove yourself from any prescribed medication or treatment without consulting your healthcare practitioner. What is Crohn's disease? Crohn's disease is a chronic inflammatory bowel disease, IBD, that causes inflammation of the gastrointestinal tract. The exact cause of the disease is not known, but researchers have found that it has an autoimmune component. And approximately 700,000 people in America are affected. It is quite a common sickness, although people are misdiagnosed or not correctly diagnosed, because it has similar symptoms than like many other diseases. There's currently no definite cure for this disease, but with proper treatment, many people can live a good quality life. Crohn's disease gets its name from an American gastroenterologist, Dr. Burrell Crohn, and he was one of the first physicians of the illness in 1932. The exact cause still remains unknown, and previously diet and stress were suspected, but now doctors know that these factors may aggravate but don't cause Crohn's disease. And several factors likely to play a role in the development are the the immune system. It's possible that a virus or bacterium may trigger Crohn's disease. When your immune system tries to fight off an invading microorganism or environmental triggers, an atypical immune response causes the immune system to attack the cells in the digestive tract. It can be hereditary, but Crohn's disease is more common in people who have family members with the disease, so genes do play a role. But many people with Crohn's disease do not have family members with the condition. This is a sketch of the anatomy of the gastrointestinal tract, which starts in the mouth because it's all to do with digestion of food. And digestion starts in the mouth where we start chewing the food and it mixes with saliva. The salivary glands are in the mouth as well and the throat, and that causes contains a starch digesting enzyme called amylase. The pharynx, where you swallow the food, it's mixed with saliva, and then the bolus, the little round food bubble, go down and into the stomach. It goes through the esophagus because that links the pharynx and the mouth to the stomach, where it mixes and churns food with gastric juice that contains acid and protein digesting enzyme called pepsin. and that creates chyme. Some people say chyme, but chyme, they mention it more often as chyme. The liver makes bile. You see where the liver is lying, which in the digestion and absorption of fat. And then the pancreas releases bile and intestinal, I'm just going to close this one off, releases bicarbonate to neutralize intestinal contents, produces enzymes that digest carbohydrates, protein, and fat. The gallbladder stores bile and releases it into the small intestine when needed. And then the small intestine digests the food and absorbs nutrients into the blood and or the lymph. The large intestine absorbs water and some more vitamins and minerals, and it's home to intestinal bacteria, and there we pass it out as waste through the rectum and anus. This is another sketch of the anatomy. So you see the stomach there. The colon is the large one, and the small twisted one is the small intestine there. You see the transverse colon, the descending colon, and then here's some little bulbs and little bubbles there, but that is inflammation. So that is in the case of diverticulitis and diverticulosis, little bubbles that form. It's actually little abscesses, and they have undergo different changes there. Excuse me. We ask who might get Crohn's disease. They say usually people can get it at any age, but usually around the age of 30 years. But then at the same time, people in the age group of 60 to 80 are also sometimes affected. Ethnicity. Although Crohn's disease can affect any ethnic group, whites have the highest risk, especially living in Eastern Europe and of Jewish descent. However, the incidence of Crohn's disease is increasing among Black people who live in North America and the United Kingdom. Crohn's disease is also being increasingly seen in the Middle Eastern population and among migrants to the United States. Cigarette smoking is thought to be one of the most controllable risk factors, but it is one of the main causes for developing Crohn's. So smoking also leads to more severe disease and a greater risk of having surgery. The family history, you're at risk, a higher risk if you have first-degree family relatives, such as a parent, a sibling, or a child. But then they say as many as 1 in 5 people with Crohn's has a family member with a disease. But as we said earlier on, it might not be the same. Like sometimes there's no family history. Excuse me. People who use a lot of anti-inflammatory drugs like ibuprofen, Advil, Aleve, or all these diclofenac sodium that you get over the counter sometimes, that can be cause of Crohn's as well. And especially the pain tablets, because it is ulcerative and it causes bad things in the gut. Excuse me. The main areas that are affected in Crohn's is usually any part of your small intestine or the large intestine, and can also be involving like multiple segments, or it may be continuous. In some people, it's sometimes only in the colon, which is your large intestine, that big ascending transverse and descending colon. Signs and symptoms of Crohn's disease can range from mild to severe. They usually develop gradually, but sometimes will come on suddenly without warning. And you may also have periods of times when you have no signs or symptoms, and that is when you are in remission. But you can also have flare-ups, which are the active periods of pain and distress. This is a picture just showing the inflammatory bowel disease. You see again the colon and the intestines there, the small bowel. And this is a normal colon. Here they show patches of inflammation. And then here they show the flat parts, which is ulcerative colitis, like ulcers. And this one is where they have the Crohn's disease, which is more like bubbles and bleeding, little ulcers, not ulcers, but it's like little abscesses in the tube there, in the bowel. When the disease is active, symptoms typically include varying symptoms, like diarrhea can be very bad, up to 6 or 9 stools. Some people have it more per day, and that can be alternated with constipation, because that is one of the symptoms that you can't really say it's only diarrhea. People can have fever and then fatigue due to lack of nutrition. Sorry, man, my throat is very irritated tonight. Fatigue due to lack of nutrition, pain and inflammation, abdominal pain and cramping, which can be very bad at times, and that can be accompanied by bloating, and it is due to strictures and adhesions, because then the bowel twists and turns and you sit in that agony. Blood in the stools, which can be dark or black when it is bleeding higher up in the tract, or bright red when it's in the lower section of the bowel. Mouth sores and ulcers due to the vitamin deficiency, and then reduced appetite and weight loss because of all these conditions. Pain or drainage near or around the anal area, and that is due to the inflammation, and you get fistulas and oozing in that area then. Other signs and symptoms that can occur when people have Crohn's, but then this is outside of the intestinal tract. So we mentioned the ulcers and canker sores in the mouth, inflammation of the eyes. It can be rhinitis or uveitis, joint pains, arthritis, and even rheumatoid arthritis. And many doctors, when I've done the research on this, has mentioned that people sometimes come without knowing that they have Crohn's disease. They come with all these other conditions first, and then later on that it becomes obvious, and they become aware that it is part of Crohn's disease. So inflammation of the liver or bile ducts, kidney stones, iron deficiency, and this is an interesting one, of delayed growth or sexual development in children. So we don't know about it because they don't have all these obvious signs and symptoms, but then that is one of the things that can happen. The conditions that I just described is some pictures here, the uveitis and iritis, and then those canker sores in the mouth, sores on the feet, all those things are very not in the bowel, but also related to Crohn's disease. The candidiasis, candida or fungal infection in the mouth, and that is one of the reasons why they get it is because they don't absorb all their nutrients, and then they get all these debilitating side effects there. Now we ask, how is Crohn's diagnosed? First, doctors can do blood tests to check for anemia, because there's always not always bleeding, but many times there's bleeding, and that makes the people very low in the iron content. And then they don't have enough oxygen to carry to the tissues, and they really become tired and stressed out. The doctor may also perform other tests to test the levels of inflammation in the liver and liver function, or the presence of inactive infections like tuberculosis. Stool studies. A stool sample so that doctor can test for hidden blood, which they call occult, you can't see that, or organisms such as infection-causing bacteria or parasites in the stools. And then more tests, that was the blood test and the obvious ones. These are the ones that they have to look inside the body with a scope or with a camera. And this is most obvious ones are the colonoscopy. That's also the sigmoidoscopy, computerized tomography, the CT scan, and then magnetic resonance imaging, the MRI, capsule endoscopy, where they say you swallow the little camera. It's like a tablet that you swallow, and that gets then passed through the body and out, but they do monitor it on a screen, so they don't have to retrieve that little camera. And then balloon-assisted enteroscopy. So all these different ones can be done depending on the severity of the condition or how far they have to check. Most of these, when they do also the barium enema, where they let you swallow barium, and that will lighten up on the camera or on the screen so they can see where there's blockages. And it can be a barium meal where you swallow it, or barium enema where they give it through the rectum. These are just little cameras I put down here, so you can see the balloon type going up, and people can see with the point of the camera there. But it's not good, really good photos here, but you can have an idea of what it looked like. Now we come to the complications of Crohn's disease. The main one is bowel obstruction, because Crohn's disease can affect the entire thickness of the intestinal wall, and over time, parts of the bowel get scarred and narrowed, and this may block the flow of digestive contents, and it's known as a stricture. So all those little scarring comes narrowed, and then can cause very much severe pain in that area, and they might require surgery. Ulcers, chronic inflammation can lead to open sores called ulcers anywhere in your digestive tract, including your mouth, the anal area, and also the genital area. Then fistulae. Sometimes ulcers can extend completely through the intestinal wall, creating a fistula, which is an abnormal collection or connection between different body parts. And these fistulas can develop between your intestine and your skin, or between your intestine and another organ. When fistula develop inside the abdomen, it may lead to infections and abscesses, which are collections of pus. And there's a story, not so nice to read up, but you see where it goes. It's the bowel, the bladder, the vagina, through the skin, and causing continuous drainage of bowel contents on your skin, causing rashes and irritation. So it's not a very pleasant condition to have. The continued complications here is the anal fissures. Excuse me. This is a small tear in the tissue that lines the anus in the skin around the anus or the skin, where the infection can occur, and it's often associated with painful bowel movements and may lead to perianal fistula. Malnutrition, as we said earlier on, due to the diarrhea and constant pain and cramping, you don't have appetite, you don't eat much, and then if you do eat, the food is not digested properly or absorbed, and not enough nutrients to keep the body nourished. It's also common to develop anemia due to the low iron or vitamin B deficiency caused by the disease. In colon cancer, having Crohn's disease that affects your colon increases your risk of colon cancer. And general colon cancer screening guidelines for people without Crohn's disease call for a colonoscopy at least every 10 years after or at the beginning of the age of 45. In people with Crohn's disease, it should be done more frequently. Skin disorders, many people with Crohn's disease may develop a condition called, this is a big word, hidradenitis suppurativa. It's a pus-forming sore, so it makes burrowing into any part of the body, and this skin disorder involves deep nodules, tunnels, abscesses in the armpits, groins, and under the breasts, and again in the perianal and genital area. So it's very sad story with this disease. Then again, blood clots. Crohn's disease increases the risk of blood clots in veins and arteries. The treatment, they say here there's currently no cure for Crohn's, and there's no single treatment that works for everyone. One goal of medical treatment is to reduce the inflammation that triggers your signs and symptoms. And another goal is to improve long-term prognosis by limiting complications. In the best cases, this may lead not only to symptom relief, but also to long-term remission. Anti-inflammatory drugs are often the first step in the treatment of inflammatory bowel disease, and they include corticosteroids such as prednisone, and it helps to reduce the inflammation in your body, but it has to be short-term and not a long-term treatment. It's usually for the improvement and to induce remission. It may also be used in combination with immune system suppressors to induce the benefit from other medications. And then, like I said, not long-term, they will then be tapered off. Other immune suppressants are used for treatment of inflammatory bowel disease, but they have to be observed because there's lots of side effects on that. And then they go to the heavier ones like methotrexate, which is one of the drugs that they usually give for people with cancer as well. Excuse me. Other medications and treatment, antibiotics, anti-diarrhea medication, pain medication, excuse me, ma'am, supplements and vitamins, nutritional therapy. The one thing that's in experimental stage, but they are already applying it, is fecal transplant. Because with immune diseases and people having low gut bacteria, the fecal transplant is quite a sophisticated one, so they don't take feces like that. They grow culture and then transplant. But that is something that is being practiced as well. And hypnotherapy to not really make the person like forget about it, but to control it more. So the next step will be surgery if all these other ones don't work. Surgical intervention. An estimated 75% of people with this disease require surgery. Many of the common surgeries for Crohn's can be done by keyhole surgery, which is laparoscopic, and the benefits are faster recovery and minimal loss of work time. And then these procedures include strictureplasty, where they remove that stricture and not remove or loosen it, resect it with or without a stoma. They cut a little bit loose where the growths are like getting together there. It is also done for repair for abscesses and fistula. And then we get open surgery, which is your laparotomies, where they cut the tummy, dissecting and removing the affected part, and then tying up again, called anastomosis. And then the other one that is common with people with Crohn's is the stoma, where they can't repair the bowel to such an extent that normal bowel function is possible. So they make an opening in the abdominal wall, and the bowel opening is brought to the outside. The contents of the bowel, called the stoma output, empties straight into the stoma bag. And the different procedures done for these operations are ostomy, ileostomy, colostomy, colectomy, and proctocolectomy. So different answers for different problems. But there is hope, and there is healing, and there is health. So all is not lost. So here I put C and apply the 9 best doctors' advice. We know that we should all get fresh air. And everybody, even if you're sick, if you get out in the fresh air and you get good air in your lungs, already feel better, your body feel much better. You have to get good quality water in, and enough water, not one glass per day, because our bodies need water to wash through, to get the blood flowing, to get the dirt out of the body. So water is needed for everything. Rest and relax. I'm jumping around because I don't want to go to the sleep part first. You have to learn to rest and relax, not to just work, work, work. You have to take time out so that your body can take a break, because otherwise you just work and things just don't get better, it just get more compounded. You have to enjoy laughter, a good belly laugh, laugh with your children, tickle somebody. Well, I can't say tickle, let them tickle you, but laughter is a good medicine. Good food, we have to get good food that is not out of the box, not out of the freezer, and freshly grown organic food, which is not sprayed with all the toxins, or if you get it, you still wash it and cook it fresh, and steamed is better. Detox your body, but detox your home as well. Detox everything that is chemical, cleaning products and all that, because most of our diseases stem from toxic cleaning substances. You have to exercise. Exercise doesn't mean you have to jump up and down or go to the gym all the time, but a good walk or just gardening or doing something in the fresh air is good. You have to get good quality sleep. When you sleep, your body repairs. So sometimes people say 2 hours, 3 hours is enough, but your body need a little bit more because certain hormones are released when you sleep, and that is done to repair your body and give your body a break. I put breathe at the last one because breathing is such an important part, because if we breathe properly, we get more oxygen in. Our body's internal organs are relaxing more, and they that. But I want to come to the thing of deep breathing, because we have the vasovagal nerve, which is connected to your stomach and to the brain. And if we practice deep breathing and cleaning your body of all the toxins and carbon dioxide, we relax it more. And then we come to the stage of not fight or flight, where we always constantly stress. We come to the stage where we come and have rest and digest. And that is the healing one. Sorry, man. I think I'm almost done here, so my throat can rest a bit. Lifestyle changes. We said that, get that one down. Sorry. The diet we mentioned earlier on, to avoid all the stuff that's hurtful and harmful to your body, all the stuff that's sprayed, so we can get. I have some here with the grains, the cheeses, the milk, the avocados, fish. That is really good for your body. So the irritating ones like the curries and spicy food and coffees and things, we should cut that out. Smoking is sitting here. Quit smoking. Life is beautiful. Because if you have the habit of smoking, it's a good time to stop now, even if you don't have a problem with Crohn's. Exercise coming in again, because all the systems are, they benefit from movement. Because if we sit still, everything is sitting tight in your body and you don't get circulation and stuff gets stagnant there. Stress, we mentioned that earlier on. You de-stress by reading books, walking the dog, doing something, reaching out to friends, join support groups. So there's lots of things that we can do to help your body heal again. I have a picture here of Crohn's disease, recommended, and what to avoid. They say bone broth, to cook the bones of the meat to get that broth out, and that is such a good thing. Not just always to have meats, but if you do have meat, have good quality meats. Veggie juices, steamed fruit and steamed veggies, and then good nutritious cooking oils like coconut oil, and then limited grains and legumes, and then food should be cooked from scratch. We said earlier on to avoid the processed foods, a lot of gluten, a lot of processed oils, dairy, yogurt, and then also refined sugars, coffees, and alcohol. I'm going to go to the good nutrition that we can use, and the Neolife supplements that we recommend is your Propack, because it has all the good vitamins in there. Your 3-in, carotenoid, omega, and multi-mineral and vitamin. And also the shake that we have all the 22 amino acids in there. And because of the malabsorption, a major problem in Crohn's disease, we need all these because the selenium and manganese is so important for healing. The aloe vera Plus is a very good one to always have and to have it regularly, because it is beneficial for Crohn's and it has a healing effect on the digestive tract and causes softening of the stools. It has a calming effect on the body, which aids healing, and it is good for gargling and swallowing, especially when you have the mouth ulcers. The garlic is the one that we know is a natural antibiotic and anti-inflammatory, and it's great value in the case of Crohn's disease. And then fiber. All fiber has all the natural content in it, and it mixes it's a blend of soluble and insoluble fiber from 12 natural whole food sources, which includes oats, fruits, and veg. And because different fibers confer different health benefits, so we know to get the fiber in is the most important thing, because it helps maintain regularity naturally, and it helps to bind the stools in case of diarrhea. So it has a twofold action. Fiber helps cleaning out the gut in the situation of constipation, and it's also prebiotic and aids in regulating the gut microbiome. Zinc and salmon oil, these are the two critical ones that we need for the repair of the inflammation. Salmon oil is needed for repair of the ulcers and inflammation of the digestive tract. And it has shown that essential fatty acids may reduce Crohn's disease symptoms and aid in maintaining remission. So all the zinc, everything is so good because that helps with the acid-alkaline balance, and it's also important for the absorption of the nutrients, and it contributes to the maintenance of the immune function. And the testosterone is another story, not needed here. And this is my last slide, back to health. If we do the things that we said, then all the red ones will disappear and our bodies will get, the gut inflammation will go, all these ones with the pain and ulcers and all those things will disappear. We take in the dietary fiber, we take good health, and then we see everything comes back to normal. And that is my story. We can eat ourselves healthy again, and it doesn't have to be so sad and black and ugly and painful. Thank you. That's my story.